Over 90% of adults over the age of 65 say that they want to stay in their homes for as long as possible, and our services enable them to do that. Midland Area Agency on Aging was established in 1973 through an interlocal governmental agreement in an 8-county area. Those counties in our area include Howard, Merrick, Hall, Hamilton, Adams, Clay, Webster, and Nuckolls. How our funding works is it comes through the Aging Network, which is headed by the U.S. Administration on Aging. The majority of our funding comes from the Older Americans Act. Most of it is all grants. We manage over 30 different grants. Each grant has very specific use that we have to follow. The ACL, which houses the Area Agency on Aging, and then we are overseen by the Nebraska State Unit on Aging, which is within the Department of Health and Human Services. There are 622 area agencies on aging in the United States, and Nebraska has 8. The AAAs play a key role in the planning, the developing, and the coordinating of long-term services and supports for individuals who are over 60. And then we each have a planning area. We have 5 core categories that we try to cover for the elderly. Those are elder rights, caregivers, nutrition. We oversee all the funding coming into any senior center in our 8-county area. So if there's a senior center there, we are involved in one way or the other, usually funding for meal programs. We do health and wellness, and then also supportive services, which means in-home services, homemaker and chore services, transportation, case management, home modification, and legal services. We also offer, or any AAA offers also probably a dozen more different types of funding and coverage for people, which would be like insurance counseling. We partner currently with SHIP, which is the state health insurance program. So we are kind of the go-to if people need help navigating Medicare, Medicaid, secondary insurance, supplemental insurance, Part A, Part B, all of that. We know how to get them signed up and help them if they happen to hop into the wrong insurance plan or anything like that. We also provide case management services and, of course, information through Senior Medicare Patrol on fraud and how to be careful about scams. A little bit more just on the elder rights slide. That's abuse prevention, again, fraud, scams. And then we also have a long-term ombudsman that's housed in our office and is our employee. A lot of people don't know what the ombudsman is. They go out into nursing homes and they are a mediator for the state. They are overseen by the state, but they help kind of talk to people and residents and make sure they understand the rules that the facility has to follow. But they also then can explain to the residents what the facility has to follow to get Medicare, Medicaid funding when they're in there. So it's a great role, and it just is a great kind of a bond for the communication to make sure everybody's getting their needs met in the facility. So if you have a loved one in there and you're having any issues with anything, ask to speak with the ombudsman and they'll kind of help you navigate that situation. Case management, we have several different pots of money that support case management services. We have some, and these are for people who are over 60. We have one category that's care management. That's for people, and that's on a sliding fee scale. Then we also have Medicaid waiver. This is another contract we have with the state. And so right now in our 8-county area, we have over 700 people on some sort of case management service. Medicaid is a monthly contact. Our care management is a quarterly contact or more as needed. And again, this is services to keep people in their home, either to bring in some grant services to help with heavy housekeeping, make sure they're taking their meds, going to their doctor's appointment. Medicaid case management is a little more intensive, where we see them monthly. We make sure if they go to the hospital, we have to go see them. So that's definitely, they're kind of a step away from heading to the nursing home, but we want to keep them in their home. Nutrition slide. Again, we oversee the senior centers, so this is one of our biggest grants we have. And so we provide home delivered meals. Last year we funded 80,000 meals in our 8-county area. Those are home delivered meals. You do have to meet a specific criteria to get those because they're more expensive to produce. Congregate meals, these are meals that are held in the senior center or at another location. We do not only the senior center meals, but we also do what's called a voucher meal. So they can go and get the same type of meal at a restaurant in our 8-county area. And these meals you can get them for a suggested contribution. If they can't pay, I shouldn't say pay, but contribute, they don't have to, and we don't know. It's all confidential. So we have to have a box set up. There's very specific programming that goes with that, and we have to provide a certain amount of nutrition with the meal, milk, starch, protein, fruit. So it's a great program, but it's offered to bring people into the center, and then also the senior center or wherever we're at is kind of our hub to tell people about our other services that we have. And we have to provide the nutrition education. So next slide is all of our meal locations. The ones on the left, Carroll, Woodbury River, Doniphan, all of those, that's where we actually have senior centers. So there's a congregate meal people can go to every day. The ones on the right are voucher programs, so they're actually in these restaurants. We go to the restaurant and we either distribute a voucher, which is a ticket. They make a suggested contribution. In Roseland, they eat once a week. So they get 5 tickets. They can go in and they make their contribution, and then they just go in and eat. So having the voucher program gives us the ability to have meal programs in more rural locations. Senior centers are very expensive to maintain because somebody has to have the building, somebody has to pay the rent, somebody has to pay the utilities. So it gets expensive. And usually the senior centers we have, it's about 8 different people who are supporting the center, the city, the county, us. We usually provide the programming and pay for some of the staff. So it's a lot of coordination. So having these voucher programs really helps get our funding out into more rural areas, which is one of our goals. Health and wellness, this is another thing we try to bring into senior centers or have available even wherever we can. Each of these, again, is funded by a separate grant. And so when we offer it, this is how we pay for this is how we pay for that, and it has to be ran in a certain way. Like Tai Chi is an evidence-based class, so we have to record where people are at the beginning, and it usually runs, I think, 10 weeks. So we have to record where they are at the beginning and then at the end, and then we send those results into the state. Some of our other exercises classes are not that way, and that's fine. Not everybody wants to come every week to a class, but we offer that so they stay strong and stay healthy. We also do certain health clinics like blood pressure, toenail. I know it sounds odd, but people have difficulty trimming their toes, so we get nurses that come in with different home health agencies, and they will help them take care of their feet. For a minimal cost, so it's not billed through Medicare. A lot of our senior centers have exercise rooms, and then, of course, part of the goal of the grants is to provide socialization and, again, get more information out to the community about our programs. One of our newer, I guess, categories or grants that we've started to receive money for is the Aging and Disability Resource Center. We call it the ADRC. This assists anybody who's over 60 or anybody that has a disability or their family. This program is more of a no wrong door, and it's kind of our outreach arm for the agency. We will help people with anything. And these are the people that are also very versed on insurance, any type of insurance. We have people and companies when people retire, like the counties will send their employees to us when they retire, because we can walk them through how to sign up for Medicare and insurance and a supplement and get that started. But we will travel anywhere in our 8-county area to see people. So if you have somebody who needs help, you know, and none of these programs, there's only one program that's income-based. Every other program we have is free. So there's no charge. All of it is funded by grants that come in through the Older Americans Act. So we will go out and see people and talk to them if they're having trouble paying their utility bills. We'll sit down and go over their budget with them and say, where can we save some money? A lot of times their money's tied up with insurance. They're paying for something that's really expensive. So we try to talk to them about some other options that might make it more affordable so they can stay in their home or get them signed up for other benefits. So it's just, again, finding community resources. So there is no wrong answer to anything or any bad question. We're there to help. So and when we get done, we leave. You have to sign up and you have to be on any type of service. It's just we come and go, and they can come back and use the service again. And oftentimes, though, we kind of incorporate people into our other programs that we have, maybe our case management services, so if they need additional support. The slide is the kind of more supportive services. One of the grants we have, or several of the grants we have, is you can get a personal emergency response system, and that's the button you push when you fall. So we have grants that help pay for that. We have in-home grants to help pay with heavy housekeeping. It's not a lot of money, but it's enough that it helps people stay in their home a little longer. It's maybe around $60 a month, but they hire the person, they bring them in, they pay the person. So, you know, hopefully their house isn't too dirty and they can do things like scrub the floors, change sheets, scrub the bathrooms, things like that, that they aren't able to do anymore. Then I talked a little bit about SHIP, which is the Senior Medicare Patrol Program, and also the State Health Insurance Program, where we talk to people about their insurance. We have a lot of volunteer services within the senior center, so we coordinate a lot of that. We get in-kind dollars from the state to support those programs. Information and assistance, it's another grant category that we get funding for. That's usually the person answering our phone that's giving out more information about our agency. And then I talked already about a little bit more about the in-home grant support, which is the homemaking. We also help pay for lawn mowing and snow removal. Again, it's not a lot, but every bit helps. It's a once-a-month grant, so up to $600 a year. So, and we can also help people if they need any type of in-home remodeling, grab bars, things like that, things to help make their home more functional so they can stay there. The last slide is the transportation services. Midland Area Agency on Aging is also Midland Public Transit. You might see our vans running around. And we're just like Crane, same thing. We provide public transportation in these counties, Howard, Merritt, Clay, Webster. We also provide Medicaid services, any type of Medicaid transportation in all of our 8 counties, including Hall County and Adams County. And we're really busy with that because there's a big need for that. It's a much needed service, so we're glad we're able to provide it in these counties. So.